All right, we're going to try this again. I'm Dr. David Hargroder, and I am waiting for Carla Hubenthal to join me. She's my patient care coordinator with the Mini-Gastric Bypass, and tonight we have a topic I think that's apropos for just getting on with our new year. A lot of people making New Year's resolutions and trying to better their lives, but sometimes we tend to get in our own way, and so that'll be the topic tonight: is exploring whether you're in getting in your own way and how we might be able to overcome that. So Carla's about to join here, and we'll see what she always brings a interesting perspective to the discussion. So let's just see what she has to say as well.
Hello
Uh,
there.
all righty, how are you?
I'm good. Long time no see.
I know,
Yes.
huh?
Yes.
All right. So, are you getting in your own way?
You bet.
Yeah. So, it's just so common. Everybody, New Year's makes those resolutions. They're
Yeah.
going to live better, live healthier. Hey, David, uh, they're going to lose the weight. They're going to, lose it once and for all. Uh, Maybe even making the decision to have surgery to lose weight, and then maybe changing their mind because they're going to do it again.
Right.
Tell me what your take is on getting in your own way.
Well, it's funny because when I started thinking about it, a friend of mine brought it to my attention. She says to me, "Have you ever thought of having weight loss surgery? I'm thinking about it myself." And I said to her, "Oh, no, 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 that's not for me." She said to me, "Well, you're really depressed." And I said to her, "Oh, no, I'm not. Oh, no, I'm not."
Now you're
And
talking
then
20 plus years ago, right?
22 years ago,
Yeah.
well, and 23 years ago. We had our lunch and she left and I went on and on my way home, I start thinking about it, about, how life to the pain that being overweight was bringing into my life. So instead of addressing it, I just kept adapting to doing less and being on painkillers, muscle relaxers. And I was even in a cart at Walmart, one of those little motorized carts. And I thought, okay, that's it. I'm done. That's it.
Yeah.
I'm done. And that's when I started my research. So, but I think what happens at that time is you have to address your fears, your doubts, all the failures of all the times you have dieted every January, every routine, and how to break that cycle. And you have to find that courage. And that really comes from research and also really looking at yourself. So, when do you recommend that we start getting out of our way?
Well, that's a really uh, kind of a complicated question to answer because everybody's just a little bit different,
Yes.
but I think the principles are still can apply to everybody, or there are some principles that can apply to everybody. And that is, uh, immediately. But it takes self reflection and honesty in order
Yes.
to overcome that, right? When we talk about getting in your way, it's your own negative talk, that subconscious little talk
Yes.
that is telling you your attempts are futile, your failures are going to repeat themselves as they
Right.
have before, and so the time to get out of it, if you ask, well, when's the right time to get out of that, get out of your own way, the time is immediately.
Yes.
uh, and I think step one is to recognize it's probably best to not try and do it by yourself. Whether it's a professional counselor, a life coach, a spouse, or a close friend that can offer you those words of encouragement and maybe some solid advice to help you to recognize your own value and the efforts that you're capable of doing that you didn't think you were doing.
Yeah.
You mentioned earlier, how you just slowly learn to adapt. And I think that's one of the big problems is it is such an insidious process. Weight gain, people seldom just blow up 100 pounds overnight.
Yes.
It's something that comes on over years. Well, I'm only 20 pounds overweight. That's not that big of a deal. And then next year, well, I'm only 20 pounds overweight from where I was last year, but now you're 40 pounds overweight,
Right. Yes.
and then as you become 60 pounds overweight, as you say, you start adapting. You quit going out to places because you just don't feel like it, either because you're depressed or you're aching or you're tired or you're out of breath. And so you tend to start staying home. And it really takes a reflection of your own life to sort of, almost like writing down on a piece of paper, what are my goals and aspirations in life?
Yeah.
Where is it that I would like to be? And then start looking at what, where am I now and how big of a gap is there?
Yes.
I would also offer that if there's not a big gap, it may very well be that you're living life perfectly, or it may be that you're getting in your own way and not being honest with yourself as you're doing your own personal evaluation.
Yes. I mean, the denial is unreal. I mean, we learn to deny it tremendously. And so it is. And just like you say, every year my clothes would get tighter. So I'd get a little bit bigger and then my clothes would get a little tighter. And I mean, it was just a vicious cycle. And then
Right.
I would starve myself. I would lose 2 pounds. I'd eat pizza on the weekend and then I'd gain 3. And so it's just like, a cycle that you almost can't break.
Yeah.
And then when you step back, and you think about it, in class, we would often say, if you were guaranteed success in life, what is it you would do? And so I would find myself in class teaching these things and then going home and going, well, no, I can't. That was the one area in life that always seemed like a failure to me.
Yeah.
And so once that is so gone, it is amazing at the freedom that comes with that being out of the way.
Yeah. And by the way, congratulations, Caitlin. She's officially down 70 pounds. I'm reading her comment there. So
Yay,
that's pretty
Caitlin.
awesome. If anybody wants to join us in this conversation, we're talking about getting out of your own way. Maybe you've got your own trips or tricks or tips that you personally have utilized. We'd love to hear from them. But I think, goal setting has to be more than just committing it in your mind that this is what you want to do.
Yeah.
It's a real process, isn't it? I mean, there are techniques used, and you do a lot of leadership training and teaching, so you might be able to address that. There are techniques that people can use to stay motivated or to accomplish things they didn't think they could otherwise accomplish. Because what we're talking about here is, going from an unhealthy, overweight state to a healthy state. And if you can do that on your own, more power to you. But the commitment that it's going to take is going to be incredible, and in some cases almost impossible, or at least superhuman in some cases, of what people have to go through. But then if you make the decision that, well, let me have surgery to help me lose weight, that's a great decision to have, because at the other end of that, a year and a half later, after you've lost 100 to 150 pounds, all of a sudden now you really start realizing your full potential, but it's
Yes.
crossing that bridge in the first place.
Yes.
It's being able to convince yourself that I am worthy to have this surgery in the first place.
Yes. It's an investment in your life. And it is. It's just a wonderful investment in who you are. And once you find that motivation and that courage, and when everyone places their deposit and schedules their surgery, I tell them, you're going to get on a roller coaster. You are going to be excited one minute and scared the next minute and excited. And that is just normal until you've had the surgery. And as you're losing the weight and life is wonderful, that's when you don't think about that anymore.
Right. Absolutely.
Yes. Yes. So you have to get out of your own way. And it's amazing that once you decide and set that goal and put pictures, I mean, you can put pictures up, your goals. That's why I love our star of the week. I love our MGB stars. To see, in fact, Kara said to me today, our Facebook coordinator, she says, these pictures blow me away. And they are. I mean, we're so proud of how we look and how different we feel and to be healthy.
Yeah.
And I'm very proud of the fact that in January, my resolution isn't to lose weight. It's absolutely because I'm at peace with that.
Right. Right.
It's
Absolutely.
wonderful not to have that battle anymore. And that's why I loved your book, because that is so true, that it's not our fault. It's not a character flaw.
Right.
But all through life, we feel like it is.
Yeah, that is a sad reality, and it's it's what motivated me to write that book was just
Yes.
hearing all of the stories, story after story of patients and the torment that whether it be self-inflicted torment or just the prejudices, the mistreatment that people have to endure from the people around them, whether it strangers that pass you that make judgments and that sort of thing. It's
Yeah.
it's a tough
And,
road.
and some of it is from family and close
Yeah.
friends. That's why I think it's wonderful to have support and tell people, but be sure that be prepared that maybe not everyone will be 100% behind you.
Yeah.
And to stand strong in your conviction and become accountable for your choices, because you'll be so proud of yourself when the journey it's the most amazing journey ever.
Yeah, I agree. We
Yes, very
just got to
much.
get out of your own way. And of
Yes,
course,
you
if
sure do.
anybody, needs help with that and needs some encouragement, they can get in touch with us and we'll walk them through the process, help them and listen to their stories. That's to me the big thing is, having somebody to communicate with and to give you words of encouragement.
Yes, and I think one of the things we're so proud of is our private Facebook page. It has 970 patients only on it. And I'm often asked, do you remove the bad things? And I always tell them, no, Dr. Hargroder will not allow any of us on staff to touch that page because we're so proud of their accomplishments.
Absolutely. Absolutely. Yeah. We want everyone to be able to express freely the good, the bad, the ugly, whatever it might be. Fortunately, most of it's good.
Yeah.
Every once in a while, there'll be a little complaint creeping in, but it's not to be concerned. And for honesty and transparency and everything else, we just need to keep those up for sure.
And I want to thank everyone who contacted me and celebrating my 22nd anniversary last week. I thank all of you. My MGB family is absolutely tremendously wonderful.
Yeah, they certainly are. Shannon, hey, glad you could join us today. Well, we're
Hi.
about to wrap up. I want to wish everyone, again, a happy new year. Stay
Yes.
committed. If you are fed up with struggling with your weight and having to take medication for your blood pressure and your diabetes and wearing a CPAP machine and all of these things, if you can get out of your own way and take that step, I
Yes.
think that you'll find that the rewards will be well beyond anything you might have expected. Carla, you want to give them your contact information? Oh, I see you just typed it there. Carla's been having some internet troubles on her end, so I think she's about gone for the night. But I'm going to go ahead and sign off. I want to thank everyone for joining us. Give Carla a call if you'd like to learn more about the mini-gastric bypass, or you can call me at my office, 417-206-2900, and we'll be more than happy to entertain whatever questions you might have. All right. Y'all have a great night.